Hi, today we're going to discuss a heart condition called hypertrophic cardiomyopathy, or HCM. HCM affects the heart, which is the muscle responsible for pumping blood through your body. To understand HCM better, let's break down the name. Hypertrophic means something is getting larger or thicker than it should be. Cardio refers to the heart, and myopathy indicates a problem is with the muscle. Therefore, it means that the heart muscle becomes abnormally thick. This thickening makes it harder for the heart to pump blood effectively, similar to trying to squeeze a very stiff balloon. The thickening can occur in various parts of the heart and affect individuals differently. Some people may not even realize why they have it, while others may experience symptoms which cause fatigue or shortness of breath.
So we know that your heart is a strong muscle that pumps blood all over your body, but in hypertrophic cardiomyopathy, a part of that muscle gets too thick and it makes the heart work much harder and not function the way that it should. Some people with HCM have noticeable symptoms, and on the other hand, sometimes people don't notice anything is wrong until they are exercising or playing hard. Other people also may not notice any symptoms at first, but they can definitely go ahead and develop symptoms and signs later on in life. And let's go ahead and take a look at some of these symptoms. First up, we have chest pain, and that's when your chest hurts, especially during activity. Shortness of breath. It may feel hard to breathe even when you're just sitting down. Fatigue. That means you feel tired even after you've rested. Dizziness and lightheadedness. Fainting, swelling, arrhythmias, and that means the heart beats in an abnormal rhythm, whether it's too fast, too slow, or uneven. HCM is a chronic condition, meaning it doesn't just go away and it can actually get worse over time. People with HCM can be at a higher risk for other problems like atrial fibrillation, a fast, shaky heartbeat that can cause blood clots or even stroke. Heart failure and sudden cardiac arrest, which that's when your heart just stops beating. So where does HCM come from? Most of the time, HCM is hereditary, meaning it runs in families. It's passed from parents to children through genes. Genes are like instructions your body uses to grow and work. Sometimes a change in these genes can cause HCM. So if someone in your family has HCM, doctors might want to check you too. But the good news is, with the right care, many people with hypertrophic cardiomyopathy live long and healthy lives.
So some of the treatments for HCM, hypertrophic cardiomyopathy, include lifestyle changes, formal medication, implantable devices, less invasive surgical procedures, and in some severe cases, heart transplant options. Where lifestyle changes are always great for anyone. Maintaining regular exercise, dietary changes, healthy living, proper hydration, these are just overall heart health techniques. But individuals with HCM conditions may have to limit their physical exertions as just not to put too much strain on their hearts. There are different medication options, such as beta blockers. These can help slow the heart rate to improve blood flow and just overall cardiac function. Antiarrhythmic and cardiac inhibitors, these medications can help and possibly repair any obstructions. Also, anticoagulants that help to prevent blood clots. However, HCM patients should generally avoid anti-inflammatory medications, and due to the risk of fluid retention, increasing blood pressure, these types of over-the-counter NSAIDs can potentially impact kidney function, where it puts more strain on the heart and can potentially interfere with any other HCM treatments. With other cases of hypertrophic cardiomyopathy, patients could potentially benefit from implantable devices, an ICD, which is a cardioverter defibrillator, or a pacemaker. These devices are to help correct any potential life-threatening arrhythmias. There are also minimum to invasive surgical procedures as an option, such as removing thickening heart muscle or injecting medications into that artery to essentially shrink the thickened muscle. But of course, in most severe cases where other invasive treatments are ineffective, a patient can undergo a heart transplant.
Hello everyone, let's do a quick summary of everything that we went throughout this video. Alright everyone, let's quickly remember what HCM is. Hypertrophic cardiomyopathy is a condition where the heart muscle becomes too thick. This can make it extremely hard for the heart to pump blood. Some people may have no symptoms at all. Others may feel pain in their chest, get dizzy, feel out of breath, or even faint, especially during exercise or doing something that gets your heart going. If you or someone you love knows has these symptoms, it is extremely important to go and seek help now. People may not know, but HCM can be managed. All it needs is just proper care. You may be wondering where to go or trusted websites to get more information about HCM. We recommend going to go see a doctor first, specifically a cardiologist. A cardiologist is a doctor specializing in the diagnosis and the treatment of diseases. Refrain from using Google and use trusted sources like mayoclinic.org or the American Heart Association. The references we used for this video includes Google Scholar, Mayo Clinic, the Heart Association, and the Journal of the American College of Cardiology. Hypertrophic cardiomyopathy can be serious, but with the right help, people can still live healthy lives. The most important thing to pay attention to is your body. Talk to a trusted adult and ask a doctor for help when needed. Thank you for watching this video and learning with us.